It is not easy to discuss with others how you want your end of your life to be, but joining me to discuss how to make some of those medical decisions is Stephanie Downs, who's a social worker with the Oncology Department of Hardin Memorial Health with the Cancer Care Center. Thank you for being here, Stephanie.
Thank you so much for having me.
Tell me about your role and how you assist families in making some of those medical decisions.
What I do with the hospital is an assessment with the patients to really understand what's going on in their home environment, who they live with, what services, what support they have in the home, and what documents they have in place. Do they have living wills, advance directives, power of attorneys? What kind of things do they have in place for those medical decisions, and what really are their goals for their treatment while they're getting their cancer treatments at the Cancer Care Center?
I think, when we think of going maybe to the physician or going for a service, sometimes we know we might be having that done, but we're not necessarily as prepared as we would like to be. Mm-hmm. So some of those documents that we might need to have in place, I think you had just mentioned, expand a little bit upon what those documents actually mean to those individuals.
A living will or advance directive allows a patient to denote a healthcare surrogate, someone that when they're not able to make their medical decisions, gives that person the power to give consent for things like a blood transfusion, an MRI, surgery, treatment, things of that nature. So it's someone that we can talk to if they need something done. It's an individual that they trust, that can act on their behalf when they're not able to. The document also allows them to denote things like if it's an end-of-life situation where they're terminal, they're unconscious, if they want life support continued or withdrawn. Do they want things like feeding tubes and nutrition continued or withdrawn? Do they want to be an organ donor or not? So it really allows them to look at those type of end-of-life decisions to really decide those things early on, or to give that power to that healthcare surrogate so that when that time comes, they've either made that decision or they've had that conversation with that surrogate so that surrogate knows what to do when that situation comes.
We've been talking about decision making. Are there different types of tracks that are involved with decision making?
There is. When it comes to care, you can do either aggressive treatment. There's kind of that middle ground, what we call palliative care, and then there's really end-of-life care. Aggressive treatment is when you do everything. So we're talking all the MRIs, all the lab work, all the treatment, the chemotherapy, everything that can be done to treat your illness. Palliative care comes in, you can still do really aggressive treatment, but we're doing more symptom management. We're making sure the nausea, the vomiting, the pain is under control. It's more of a comfort care, not necessarily end-of-life care, which is what most people associate palliative care with, but it's making sure your symptoms are being managed. End-of-life care is solely end-of-life care. When your treatment options are, it's not working, you're no longer wanting to come back to the hospital anymore, you're no longer wanting that lab work done, the treatment is not curing the cancer anymore, and you just want to be home and you want to be comfortable. And a lot of people think of hospice at that point in time. That's a service, it's an agency that provides that end-of-life care. So part of my job is to help, based on your goals, to decide what track we need to work on and make sure that you get the resources that you need in the home and at the center to be able to accomplish those goals.
Stephanie, we've been talking about decision making. Do you have some suggestions for how to spark those conversations with your healthcare provider and your loved ones?
I direct my patients to a website called the Conversation Project. They actually have a conversation starter kit that helps individuals walk through some things to think about. The main thing is to look at what are your goals. What would you want when that time comes? What type of care would you want? Would you want to be in a nursing home? Would you want to be at home? Would you want to be comfortable? Would you want everything done? So it walks step by step through some of those tough questions. And then once you decide what you want, then it asks you some questions like, okay, where's a good setting to have this conversation, and who do you want to have this conversation with? Do you need to have it with a spouse? Do you need to have it with your children? Maybe you need to have it with your doctor first. And of course, wherever you're at your point in life is going to impact what your goals are. You know, a young 20-year-old, you're going to want everything done because your chances of survival and where you're at, and you know, you've got children and things, are going to impact those decisions. Where when maybe you're a little bit older, you've lived your life, you know, you don't have children and things maybe necessarily to live for as you did before, so your goals will change, and you have the right to change what your goals and your decisions are going to be. And that's the great thing. You have the right to change your mind. Nothing's ever set in stone, and I think people don't realize that as well. Just because today you decide you want to be comfortable doesn't mean tomorrow you can say, you know what, I've changed my mind, I want to be a little bit more aggressive, and that's okay.
So it sounds to me like it's important to have that conversation, revisit that conversation, and that's what we encourage you to do here on Health in the Heartland. Thank you for joining us, and for more information, go to www.hmh.net.